Assalamualaikum warahmatullahi ta'ala wabarakatuhu. A pleasant day to each and everyone. So in this video, we will discuss the last topics that are included in our final exam. So we have here the enteral feeding and also the parenteral feeding or parenteral nutrition. So itong dalawang to ang i-discuss natin. Okay, ipag-differentiate natin sila kung ano ba yung meaning ng parenteral feeding or parenteral nutrition and the enteral feeding or enteral nutrition. So, enteral feeding or enteral nutrition pertains to the delivery of food and nutrients either orally or by the tube directly into the GIT or gastrointestinal tract. So, it is intended for patients with a functioning GIT but unable to ingest the required nutrients orally or for patients with impaired digesting capacity or unable to absorb nutrients. Again, it is used on patients with a functioning GIT. So, meaning nagpa-function yung GIT niya, yung gastrointestinal tract niya. However, they cannot or they are not able to ingest, meaning hindi nila makain through oral yung pagkain and hindi nila ma-absorb yung kanilang nutrients or very deprived yung kanilang digesting capacity. Okay? So, yun ang ating enteral feeding. Again, it pertains to the delivery of food and nutrients either orally or by the tube directly into the gastrointestinal gastrointestinal tract or the GIT. So indications, these are indicated for may anorexia or may loss of appetite. Ayaw nilang kumain. So, yung mga anorexic kasi na tao, yan yung mga taong may anorexia is a mental disorder or an eating mental disorder na yung pagtingin nila sa sarili nila is sobrang taba, pero in reality, sobrang payat na nila. At dahil doon sa kanilang vision, nakikita nila sa salamin na ganun sila kataba, hindi sila kumakain or dinedeprive nila yung sarili nila with the right nutrition. But so that's why it's indicated sa mga mga anorexic patient ng enteral feeding. We have also orofacial fractures, yung mga may fracture sa mukha or sa bibig. We have also head and neck cancer, neurologic or psychiatric conditions that prevent oral intake, the extensive burns, lalo na kung sobrang sunog na yung kanilang mga bunganga, critical illness, especially if mechanically ventilation is required. Okay? So, mga contraindications or mga pinagbabawal na bigyan ng enteral feeding ay ang mga sumusunod. First, they have GI obstruction. So, hindi tayo pwedeng magbigay ng food or nutrients through a tube, okay, directly sa GI tract kung merong obstruction, pero may problem with the may problem na tinatawag na ileus, meaning yung ileum niya is hindi nakaka-absorb or nakaka-digest enough na absorb ng mga nutrients. We have severe diarrhea, we have vomiting, and we have enterocutaneous fistula. Basically, anything that significantly interfere with normal GI function is contraindicated sa ating enteral feeding. So, ano ba yung route of feeding ng ating enteral feeding? So, example lang is the nasogastric tube. So, from the word nasogastric, so yung connection ng ilong papunta sa tiyan. This is a feeding tube which is inserted via the nose and exits in the stomach. Again, dumadaan yung tube dito, nagmumula sa nose papunta sa stomach. In adults, the tubes are usually 90 to 100 centimeter long. So, ito yung ating nasogastric tube. Pinapasok yan siya hanggang sa stomach. Okay? So, we have also the nasoduodenal tube. So, from the word duodenal, meaning hanggang sa ating duodenum. Yung kanina is nasogastric kasi from the word gastric, the stomach. Ito naman, from the word na duodenal is sa duodenum. So, the nasoduodenal tube feeding is inserted in the same manner as the NG tube but is allowed to pass into the duodenum usually with assistance, either endoscopic or radiological. This is used to overcome the problems associated with gastric stasis, and it is also referred to as post-pyloric. So yan ang ating nasoduodenal tube. We have also the nasojejunal tube. So from the word jejunal, meaning ang connection niya is from the nose up to the jejunum. Okay, so it is the part of our small intestine. So nasojejunal tubes are usually inserted endoscopically or radiologically to ensure that they are in the correct position in the jejunum. These tubes are prone to blockage owing to their length, usually more than 150 centimeters. Syempre, mahaba na kasi papunta na siya sa ating small intestine. And we have also the percutaneous gastrostomy. So, percutaneous gastrostomy, from the word stomy, okay, nagkakaroon tayo ng opening sa ating stomach area. So, doon natin pinapapasok. So, percutaneous gastrostomy tubes are inserted into the stomach via the abdominal wall, most commonly endoscopically, or yan yung tinatawag nating percutaneous endoscopic gastrostomy or our PEG. So, ito siya, binubutasan yung ating tiyan, and then direct na pinapasok natin dyan yung mga pagkain or mga certain foods, nutrients that are blenderized. Okay? So we have here also the percutaneous gastrostomy, a permanent tract or a stoma forms after 3 weeks. The device is held in place with an internal balloon or bumper or an external fixator. So example, ito yung stomach, okay? Nagkaroon na siya dyan ng butas, okay? Binutasan na yan. So ipapasok yung tube, and then mag-inflate ng balloon para naka-hold yan siya. And then here's the skin, and then ito yung naka-clamp kasi ito yung ino-open close natin para in times na mag-feeding tayo, binibigay natin sa kanila. And then we have also the percutaneous jejunostomy. So the percutaneous jejunostomy tube is inserted into the jejunum via the abdominal wall endoscopically, or yan tinatawag natin percutaneous endoscopic jejunostomy. It's either pwede ding radiologically or surgically. They are held in place either externally with stitches or internally with a flange or dacron cuff. So, dalawang klase para ma-hold yung ating percutaneous jejunostomy. It's either internally, nagkakaroon tayo ng, flange or a dacron cuff or parang balloon inflated, or external naman mayroong mga stitches. Then we have the percutaneous gastrojejunostomy. So from the word gastrojejunostomy, the stomach and the jejunum. So ayan, pinapapasok dito from the stomach and then papunta sa ating jejunostomy. So this tube is inserted into the stomach via the abdominal wall, and the exit of the feeding tube is placed into the jejunum, most commonly endoscopically, or what we call the percutaneous endoscopic jejunostomy or PEG-J. So ayan ang ating, so para siyang itsura ng ating catheter na ini-insert sa ating ureter, okay, na kung saan may dalawang butas yan siya, kung saan pwedeng bigyan dito sa tiyan automatic or dito sa ating jejunum. So, before that, ano yung mga types of enteral formulation? So, ano yung mga binibigay natin na mga form of mga pagkain through enteral feeding? So, first, we have the ready-to-use formulation. So, ready-to-use formulation such as nutritionally complete formulation. This can be used alone and provides total needs in a specified volume of formula. We have also the modular formulation, which provides the different forms of individual nutrients to supplement existing formulas. And we have the combined formulation, which meets the therapeutic needs. Other than ready-to-use na formulation, okay, we have the tube feeding. So this type of feeding may be prepared from regular foods. And we have also the standard tube feeding. So this type of feeding is fiber-free and high in cholesterol, fat, and sugar. It is a milk-based formula with sugar and soft-cooked eggs. And we have also the blenderized tube feeding, which is consists of soft diet allowances which can be blenderized easily. Okay, so yan yung, again, yan yung mga types of enteral formulation. So isa-isahin natin, we have the ready to use, we have, the next is the tube feedings. The next, we have the standard tube feeding. Yan. And then lastly is the blenderized. Blenderized tube feeding. Yan. So yan yung mga types of enteral formulation, yung pwedeng pagkain or formula na binibigay natin through enteral feeding. So next, let's discuss naman is the parenteral feeding. So ano naman yung ating parenteral feeding? How is it different from the enteral feeding? Okay. So parenteral feeding is designed for individuals who cannot accept or assimilate nutrients given enterally. So yung kumbaga yung mga parenteral feeding is yan yung type ng feeding na hindi niya natitake yung enteral feeding. Okay, so meaning hindi na talaga siya makadigest ng food kasi yung kanyang gastrointestinal tract is very obstructed or sobrang sira na. So, pinapadaan natin to through our veins. We have intravenous alimentation. We have also the nasoduodenal tube, nasojejunal tube, okay, gastrostomy tube, okay, so yan, mga TPN. That is the total, it's either partial or total parenteral nutrition. So, the access, it is through peripheral lines which may be used to deliver short-term nutritional support, but central access is necessary for parenteral feeding for more than 2 weeks duration. Lines should be dedicated to feeding and must not be used for drug administration or blood sampling. So, dapat yung mga lines na yan, dalawang access lang. Again, we have the peripheral lines and the central lines. So, dalawang access meron tayo sa ating parenteral feeding. So, hindi siya pwede, again, dedicated solely lang siya sa feeding at hindi siya pwede gamitin for drug administration and blood sampling. So, central catheters and ideally tunneled subclavian vein. So, again, subclavian vein dito banda sa ating shoulders. Okay, sa neck, inserting using a full aseptic technique are the optimal method of access. The central access allows delivery of more concentrated formulation into high flow vessel. So, ito yung baka nagtataka, ano ba yung central and peripheral? Ito yung ating central. Pinapadaan natin dito banda. Okay? And for the peripheral, ito papalayo. Yan, dito banda sa ating brachial artery. So, the peripheral administration is achieved through peripherally inserted central catheters or standard cannulae which is inserted with an aseptic technique. The tolerance to peripheral lines is increased with feeds of low osmolality and neutral pH and the use of soft pediatric cannulae. So, ito yung difference or advantages and disadvantages of our parenteral and enteral feeding. For an enteral feeding, okay, may mga advantage siya. So, it is, physiological. It is simpler, okay, kasi bubutas ka lang, mag-insert ka lang ng tube, sobrang dali lang, 'di ba? It's cheaper. Okay? No CVL required, less monitoring, less complication. The disadvantage of enteral feeding nga lang is dependent siya sa GIT function. If nagfa-function pa yung GI tract niya, pwede tayong mag-enteral. Pero if wala na talagang function, hindi tayo pwedeng magbigay ng GI, enteral feeding. So, pwedeng magkaroon din ng diarrhea yung patient. Okay? Merong feeding intolerance kasi nasanay na pinapadaan sa, direct sa kanyang GI tract. We have also, sa NG tube or yung ating nasogastric tube, pwedeng magkaroon ng malposition and then magkaroon ng sinusitis or pulmonary aspiration. Kasi what if nagkamali yung insertion ng nasogastric and then doon na lang siya hanggang sa lungs. So, nagfi-feeding ka na pinapakain mo yung lungs instead ng kanyang stomach. So, dapat every now and then, before feeding, ang rule sa feeding natin ng enteral feeding, before and after, kailangan na check natin if nasa tamang position yung ating tube. If not, and then reinsert again the tube before ulit magbigay ng feeding. Okay? So for the parenteral, the advantages, independent siya sa GIT function. Kahit hindi na nagfa-function yung kanyang GIT, okay lang kasi pinapadaan natin siya through peripheral line or through our central line. So, pag sabi natin central or peripheral, it's pinapadaan natin siya sa veins. So, para siyang dextrose. Kaya, hindi na kailangan na dumaan siya sa ating stomach kasi automatic na nasa bloodstream natin. Disadvantage niya nga lang is non-physiological. It requires venous access. It's higher risk siya for systemic infection kasi automatic ang ang attachment niya is through the vein, di ba? And it is more expensive and more complicated. So yan ang ating parenteral and enteral feeding. So, in times na pagbigay natin ng mga parenteral feeding or mga times na, ayun na nga, nagbibigay tayo ng parenteral feeding, there are things that we need to calculate, okay? Na we need to calculate for of the nutritional needs for hypermetabolic patient. First is we need to check kung ano yung energy, okay? Mga ilang percent ng energy yung makukuha niya out of that feeding. Next, the protein kailangan increased about 50 to 100% to compensate for catabolic effects and increase din yung ating vitamins and minerals as much as possible, complete. Pero nevertheless, hindi natin complete yan siya kasi yun na nga, there are different foods na pwede nating makuha ng iba't ibang vitamins and minerals. Ang role lang natin dito is just to ensure that the patient receives enough nutrients coming from the feedings and also fluids. Syempre, dapat nakakainom pa rin yung patient and there is water present in the feeding. Again, so magkaiba yung formulation niya ha. Yung sa parenteral feeding, it's a type parang may pagka-liquid type na siya kasi madali siyang ibigay kasi nga through vein, hindi pwedeng malilaki katulad sa enteral feeding. Yung mga formulation kasi sa enteral feeding is parang blenderized, okay, para siyang shake na type. Pero sa parenteral, hindi siya shake, it's more on liquid form kasi nga it's through venous access, not direct kumbaga na connection sa stomach at kailangan pang i-digest. Doon kasi is sa parenteral nutrition, pinapadaan na sa veins para absorb na siya diretso sa ating blood stream. So, I hope naintindihan ang ating enteral and parenteral nutrition. So, next, I will make another video for the last topic na included sa ating final exam. So, hindi ko muna idadagdag dito kasi masyadong mahaba yung isang topic na i-discuss ko. So, thank you for watching this video and please do take notes of this one and prepare for the exam through online. Okay? So, thank you and wassalam.